Picture this.
Yeah.
A moment that just completely shatters your world. You, or maybe someone you love dearly, gets a cancer diagnosis. And that initial shock, it gives way to this flood of questions, anxieties. And, for older adults and their families, these feelings often feel uniquely amplified.
They really do.
It's not just about facing a life-altering illness, it's trying to navigate this bewildering maze of medical decisions where, let's be honest, a perfect path often feels impossible to find.
Yeah, elusive is a good word for it.
The sheer weight of making that choice, especially when you're juggling questions about independence, quality of life, what the future even looks like, it can feel, well, completely overwhelming.
It's an incredibly challenging time, precisely because it forces families to confront not just the disease itself, but that really delicate balance between hope and sometimes quite stark realities.
Right.
That feeling of being adrift, and all this complex information, or that deep-seated fear of making the wrong decision. It's not just understandable, it's a deeply human response to immense pressure. And when we specifically talk about cancer surgery for older patients, the stakes, they feel even higher. We're talking about bodies that often have, well, different physiological reserves. And the recovery journey can be significantly more complex, more unpredictable than it might be for someone younger.
And that's really the core problem we're tackling today on the Deep Dive. Our mission here is to provide you, our listener, with a clear, structured, and hopefully a profoundly human way to approach this monumental decision. Deciding on cancer surgery for older patients.
Yeah.
We spent a lot of time combing through expert sources, really distilling the most crucial insights, all designed to help you feel truly informed, empowered, and just better prepared for those critical conversations with the medical team.
Kind of a roadmap.
Exactly. Trying to give you a shortcut to being well-informed, armed with the questions that genuinely matter in this situation.
And the central tension, like you said, it really lies in this delicate balancing act. On one side, there's that powerful, undeniable hope for a cure, right? The chance for more time, maybe significantly more time.
A huge motivator.
Absolutely. But then there are the very real questions about the risks. And not just the immediate surgical risks we often think about, but those deeper, sometimes hidden risks. Risks to independence, to living life on your own terms. How will the body, especially one with potentially diminished physiological reserves, actually handle the huge stress of major surgery? It becomes this deeply personal calculation, weighing those potential outcomes against a desired quality of life, a life that feels worth living to that person.
So what's the proactive solution here? How do we navigate this? Well, our sources strongly advocate for a deliberate, proactive approach to dialogue. Talking with the medical team.
Communication is key.
Totally. And they highlight how a well-structured checklist, and we'll get into that, can be an incredibly powerful tool for both patients and their caregivers. So this deep dive, we're not just going to hand you that checklist. We're going to really dissect it, explaining not just what to ask, but critically, why each question carries such immense weight in this unique, often vulnerable context.
Think of it as your essential roadmap.
Yeah, exactly. Making sure every critical angle is explored, every concern addressed, long before any final decision is made.
Okay, so let's start by truly understanding the terrain we're navigating. That experience of a cancer diagnosis, it goes so far beyond just getting a medical label, it becomes a profoundly life-altering event.
Right. It's not just the patient.
No, absolutely not. It reverberates through their entire support system. Spouses, kids, close friends, the whole family network, really. The emotional burden can be immense. You see waves of fear, deep uncertainty about what's coming, maybe even a kind of anticipatory grief for the life that was, or the life they thought they'd have.
And it's not just emotional, is it? Practically speaking, a cancer diagnosis can completely upend daily routines.
Oh, absolutely.
There are often significant financial burdens, treatment costs, maybe lost income, and just the logistics. Coordinating appointments, managing meds, arranging transport. It's incredibly taxing.
It really is.
Yeah.
Especially for families who might already be juggling complex lives. And imagine doing all that while processing the sheer emotional weight of the diagnosis itself.
Yeah, it's a lot for anyone, but especially perhaps for an older adult and their caregivers who might be older themselves.
Precisely. And this leads us straight to why the considerations for older patients become exceptionally distinct. Because for them, the decision to have surgery, it's definitely not a one-size-fits-all situation.
Right.
What might be a standard recommendation for a healthy 40-year-old could be profoundly different, maybe even ill-advised for an 80-year-old. our sources really hammer this home age itself isn't the only factor, but rather the physiological changes that often come with age.
Okay, so let's unpack those unique considerations. The things that make cancer surgery for older adults such a nuanced discussion. The first one, and maybe the most critical, is what the experts call diminished physiological reserve. Can you break that down for us?
Certainly. So what this basically means is that as we age, our bodies typically have less capacity to bounce back, to sort of regain their balance after major stressors like surgery. Think of it like this. A younger, healthier person might have a large, full reserve tank of resilience, right? They can draw on that when faced with the huge demands of an operation: blood loss, anesthesia effects, inflammation, tissue trauma. An older individual's tank, though, it might already be half empty, maybe even less, before they even start. So a standard surgical stressor that a younger body would absorb and recover from relatively quickly can, for an older body, trigger what our sources really powerfully describe as a cascade of complications.
Cascade of complications. Yeah, that phrase itself sounds quite alarming. What does that actually look like, practically speaking, for a patient and their family?
Right. It's not just about feeling a bit more tired. It means the body has less capacity to withstand the hits surgery delivers. So, for example, a minor infection that a younger person's immune system would fight off quickly. It might overwhelm an older patient, leading to a longer hospital stay, maybe even sepsis.
Wow.
Or the systemic inflammation from the surgery could push an underlying heart condition over the edge, leading to cardiac complications.
Yeah.
We often see post-operative delirium, that sudden, fluctuating state of confusion.
That must be terrifying for families.
It is incredibly distressing, and it can lead to a longer, much tougher recovery. Prolonged immobility after surgery, which a younger person might bounce back from with some physio, can lead to severe deconditioning in an older patient.
Making them weaker?
Significantly weaker, yeah. Less independent, more susceptible to things like blood clots or pneumonia. This cascade means one problem can quickly trigger another, hitting multiple organ systems at once.
Okay, that paints a very clear, sobering picture. And often going hand in hand with that is the issue of multiple comorbidities. This isn't just having one or two other health issues, right?
Yep.
It's about how they all interact.
Precisely. Older patients frequently come to surgery with a whole range of pre-existing conditions, things like heart disease, diabetes, chronic kidney disease, lung conditions, you name it. The critical insight here isn't just that they exist, it's that they don't just add to the risk. They often multiply it in really complex, sometimes unpredictable ways.
Okay. You give an example.
Sure. Imagine a patient with both heart disease and maybe poorly controlled diabetes. The stress of surgery can throw blood sugar levels way off, right? Which in turn puts immense strain on the heart, potentially triggering an arrhythmia or even a heart attack. Or a specific anesthesia drug might be perfectly safe for a healthy person, but could cause acute kidney injury in someone with underlying kidney problems. So understanding this intricate interplay is absolutely crucial because it makes the risk assessment far, far more complex. It demands a truly individualized surgical plan.
That really deepens the understanding of why this is such a unique situation.
Yeah.
And it leads us to that third critical consideration you mentioned earlier, balancing cure versus quality of life. For many older patients, this isn't just about extending life at any cost, is it?
No, it's often a profoundly personal, sometimes agonizing calculation. For many older adults, maintaining their independence, their ability to enjoy daily activities, interact meaningfully with family, pursue hobbies, or just live without significant pain or major functional limits that can be just as important, sometimes more important, than simply adding months or even a few years to their lifespan. And this raises a vital question for everyone involved: the patient, the family, the medical team. How do we truly weigh these different priorities? Is an aggressive surgery, one that might offer a statistically decent chance of cure, but comes with a high risk of a long, difficult recovery, maybe permanent loss of independence or severe side effects? Is that the right choice if the patient's main goal is to maintain their current quality of life and avoid really burdensome treatments?
It's a different way of defining success.
Exactly. It's not just about choosing between life and death. It's often about choosing how that life is lived.
That's such a powerful distinction. And this is precisely why an informed decision isn't just important, it's absolutely paramount. It's why our sources stress so strongly the power of that proactive dialogue and the comprehensive checklist we're about to walk through. This list of questions, it's not just a guide, it's really an essential roadmap. It helps ensure every single angle before, during, and especially after the operation is not just covered, but deeply explored.
So you're an active participant.
Exactly. You're not just passively receiving information. You become an empowered, active participant in your own care, armed with precisely the right questions to get the answers you need to make the best choice for you.
Okay, so let's dive into that essential pre-surgery checklist, really unpacking the before any surgery happens. The main goal of your questions should be to get a crystal clear understanding of what's being proposed, its potential impact on your overall health, and what the expected outcomes really look like.
Right. It's not just getting facts.
No, it's about actively managing expectations and, crucially, making sure the treatment aligns perfectly with your individual values, your definition of quality of life, and your priorities for the future. It's about shared decision-making in action.
Absolutely. Making sure everyone involved, patient, family, medical team, is totally on the same page about what success actually looks like and what the journey to get there really entails. So our sources break these pre-surgery questions into several critical categories. The first, as you said, is about the necessity and goals of the surgery. This is where you lay the absolute foundation.
Indeed. It sets the groundwork. And often, what seems like the simplest question can uncover the most critical information.
Right. So let's kick off with what sounds maybe obvious, but is often surprisingly glossed over. The first question: what surgery am I having? Why is this the absolute starting point?
You're right. It sounds incredibly simple, almost self-evident. But the insight here is actually quite profound. It's not enough to know you're just having surgery or even cancer surgery.
Need the specifics.
Exactly. You need to know the specific procedure by its proper name, what precise body part it involves, and what exact anatomical changes are going to happen. Like, are we talking about a partial colectomy, a lobectomy, a radical prostatectomy? Each of those terms unlocks a whole different world of specific recovery timelines, potential dietary changes, long-term impacts on digestion, breathing, urinary function, even potential body image changes that are unique to that specific operation.
Okay.
Without that precise foundational understanding, the rest of the conversation about risks, benefits, recovery, it's all built on shaky ground. You can't really prepare for the road ahead if you don't know its specific twists and turns.
That makes a huge difference. Knowing the exact term lets you research, ask much more targeted questions. Which leads us right to the second question. Why do I need this operation? This isn't just asking for the diagnosis again, is it? It's about the purpose.
Exactly right. This digs into the fundamental reason why this specific intervention is being recommended. Is it truly curative, meaning the aim is to remove all the visible cancer, potentially cure the disease? Or is it palliative, meaning the goal is more about relieving severe symptoms, like really bad pain, bleeding, a blockage improving comfort, or preventing future problems that would seriously impact daily life, even if it doesn't get rid of the cancer entirely.
And palliative doesn't always mean end of life, right?
Correct. That's a common misconception. Palliative care can happen at any stage of a serious illness. It's about enhancing the quality of the time you have, not just focusing solely on extending it. Understanding this core reason, cure versus palliation, helps you gauge the urgency, the expected benefit, and crucially, whether the surgery aligns with your personal goals and values. Especially important for an older patient weighing those priorities.
That distinction, curative versus palliative, it really shifts the whole perspective. Knowing if it's about cure or comfort makes a world of difference. Which brings us to the third question. What happens if I do not have the operation? This feels absolutely critical for understanding the full scope of the choice.
Oh, it is. It might be one of the most vital questions you can ask. This provides the complete picture, gives you the context you need to truly weigh your options.
What would happen anyway?
Exactly. What's the natural progression of this disease without surgery? Will the cancer likely spread faster? Will symptoms get significantly worse, and how quickly? What's the likely timeline without treatment, and how would that impact your daily life, your independence? This question helps patients and families realistically weigh the known risks and burdens of surgery against the very real, often profound risks of doing no surgery. It gives you that drink line for comparison, which is essential for truly informed consent and making a decision you feel good about.
And the fourth question kind of rounds out this foundational category. Are there other treatment choices, and what is the best option for me? This really opens up the whole spectrum of possibilities.
Precisely. This question demands that shared decision-making process we talked about. It ensures you explore all the available avenues, For an older patient with multiple health issues, maybe someone prioritizing quality of life over really aggressive treatment. Well, a highly invasive surgery with maybe a low chance of cure might not actually be the most beneficial path for them.
So what else might there be?
Well, there could be less invasive procedures, maybe targeted radiation therapy, specific chemotherapy regimens, immunotherapy, or even a watchful waiting approach where you monitor closely but don't intervene immediately. These might be more aligned with their overall health status, their priorities, what they genuinely hope to gain. This question isn't just about getting a list, it's about asking the surgeon to explain, based on your unique health profile, what they genuinely believe is the best option for you and why. It ensures a holistic view, tailoring the recommendation.
Okay, that covers the necessity and goals. Really important groundwork. The next major category focuses on risks and benefits tailored to the older patient. This is where the personalization really truly has to happen.
Indeed. This is where we get into the specifics that particularly apply to the older body. So the fifth question to ask is, what are the risks and possible problems of having the operation?
Now, this isn't just the doctor rattling off a generic list from the consent form, right? Why is it so important to ask this with the emphasis on your specific situation?
You're absolutely right. This needs to move way beyond that generic list. It should be a detailed, personalized discussion for your unique situation. What are the specific surgical risks for this particular procedure in someone of your age?
Yeah.
What are the infection risks, given your medical history or any existing vulnerabilities? What about the specific anesthesia risks, particularly for your older heart, lungs, or kidneys? This is where critical thinking comes in. What are the specific concerns for this patient, considering their age, their other health conditions, maybe their frailty level, rather than just a boilerplate explanation?
Like the example you gave earlier.
Exactly. The risk of a lung complication after abdominal surgery is much higher for an 80-year-old with COPD than for a healthy 30-year-old. This question ensures the discussion is actually relevant to you.
And that ties directly into the sixth question. How does my health and lifestyle change my risks? This is fascinating because it really forces that personalization.
This is a cornerstone question for older patients. It forces the medical team to see you as an individual, not just a diagnosis or an age number. Factors like frailty, which isn't just feeling wet, it's a measurable state where your body's systems have very little buffer left. Your pre-existing heart conditions, how well your diabetes is managed, your nutritional status, even just your baseline activity level, these can profoundly impact surgical outcomes and recovery.
So being frail makes a big difference.
A huge difference. Someone significantly frail might be at much higher risk of complications from anesthesia, from prolonged bed rest, even from a simple post-op infection. This question helps the team consider how your unique physiological reserve and overall health play into your specific risk.
And can they do anything about it beforehand?
Potentially, yes. Critically, it opens the door for them to perhaps mitigate some of those risks through preoperative optimization, things like nutritional support, maybe some targeted exercise, prehab they sometimes call it. It's about understanding your unique body and how it's likely to react.
So it's not just about what could happen, but how your body specifically will likely cope. Then the seventh question, what is the expected length of hospital stay and recovery time? This sounds purely practical, but why is it so vital, especially for older patients and their caregivers?
Oh, it's incredibly vital. It provides that practical, real-world information needed for planning, which often gets lost in the shuffle of medical details. For a younger, healthier person, a week in the hospital might just be an inconvenience. For an older patient, it can impact absolutely everything. Can they return home safely? Will they need extensive home care? What about rehab needs that could stretch out for weeks or even months?
So standard recovery times might not apply.
Often not. What might be a standard, relatively quick recovery for someone younger could necessitate much more extensive support, maybe even a stay in a rehab facility or a skilled nursing home for an older individual to regain their strength, mobility, and independence. Asking this allows families to plan ahead for caregiving duties, potential financial strains, and those critical logistical challenges that can significantly impact everyone's well-being.
Yeah, it makes perfect sense. Knowing the real-world impact allows for proper preparation, managing expectations. Okay, let's talk about the next crucial category. Impact on quality of life. Because for many older patients, as you said, this isn't just important, it can be the defining factor.
Absolutely. For many, a meaningful life is truly about how they live it, not just how long. So, the eighth question to ask here is, what do you hope to gain from this surgery? Asking the patient directly.
And why is this framed from the patient's perspective? Not just survival, but a deeper personal goal.
Exactly. This isn't just about surviving the operation or adding time. It's about uncovering the patient's profoundly personal purpose for going through such a significant thing.
Like what?
Well, do they hope to finally eliminate debilitating pain that's ruining their sleep? Regain the ability to walk without a walker so they can visit a grandchild? Be able to enjoy food again without constant nausea? This question helps the medical team truly understand the patient's priorities beyond just clinical outcomes and statistics.
Right.
It opens a vital dialogue about what a successful outcome looks like from the patient's unique perspective, which might be very different from what a surgeon typically measures as success.
So success could be attending a wedding, or just reading without pain.
Precisely. The insight here is realizing the medical team needs to understand your specific definition of better. What does improvement look like to you?
That's such a powerful shift, moving from the purely clinical to the deeply personal. Then, the ninth question. How will this operation affect your activities and your lifestyle? This gets right down to the nitty-gritty, the daily realities, doesn't it?
It absolutely does. This brings the conversation down to earth, to the practical daily realities of life after surgery. Will I still be able to walk my dog? Play with my grandkids? Cook for myself? Drive? Will I need help getting dressed or taking a shower? Understanding these potential changes to daily routines, physical mobility, personal independence, it's paramount for truly weighing the benefits of surgery against the potential sacrifices. For an older patient, losing the ability to do basic daily tasks can drastically reduce their quality of life, even if the cancer itself is gone.
Yeah.
This question uncovers those very personal, very practical implications. It helps paint a realistic picture of what post-surgical life might actually look like.
And the 10th question really seems to tie it all together, connecting the surgical outcome directly to the patient's actual lived experience. Will surgery improve my quality of life? In what ways?
Yes, this question connects directly to the patient's deepest values and their day-to-day experience of living. Like we've said, for many older patients, keeping a certain level of independence, enjoyment, connection, that's as important, maybe more so, than just lifespan.
So will the outcome actually make life better for them?
That's the core of it. This question probes whether the physical or functional changes expected after surgery will genuinely enhance their lived experience. For example, if surgery gets rid of a painful tumor but leaves them essentially bedbound, totally dependent on others, or struggling with severe cognitive fog, is that truly an improvement in quality of life for that individual?
Right.
It's a highly personal evaluation. And the medical team needs to understand the patient's unique definition of better and how closely the likely outcome actually aligns with it.
Wow, those 10 questions are an incredibly comprehensive roadmap just for the before phase. It really highlights how much thoughtful preparation and deep dialogue is needed before making a decision. But as our sources also make very clear, the decision-making and the critical planning, they don't just stop when the surgery's over. Life after cancer surgery, especially for older patients, presents its own distinct set of crucial questions and challenges.
Absolutely. This phase extends into long-term management and requires just as much thorough planning. It's about looking beyond the scalpel and into the whole recovery process and the future.
Exactly. This transition from the immediate crisis of surgery to the reality of recovery and long-term adaptation, that's often where patients and families can feel the most vulnerable.
It's very true. The immediate threat might seem to have passed, but the journey of healing is really just beginning. Our sources meticulously break this down too into several more critical categories of questions, equipping you for that complex post-operative landscape. The first is about post-operative recovery trajectory.
Okay, so the 11th question in this post-op phase is, what can I expect during recovery? Why is anticipating this trajectory so important for patients and their families?
This question is foundational. It empowers patients and, just as importantly, their families to be active, informed participants in the recovery. Knowing what's considered normal, typical pain levels at different stages, expected fatigue, limits on movement or activity, even common emotional ups and downs. It helps them provide better care, set realistic expectations for daily life, and crucially seek help promptly if something seems genuinely wrong or different from what was expected.
Avoids unnecessary panic.
Exactly. Without that clarity, every little ache, every weird sensation, even just having a bad day can trigger huge anxiety and worry. It could lead to missing real red flags or making unnecessary trips to the emergency room. It transforms that uncertainty into informed vigilance.
That proactive knowledge can definitely alleviate stress and help focus energy where it's most needed. And the 12th question gets even more specific, diving right into the practical stuff. Can you tell me about my wound care, lifting, and activity changes?
Yes, these are the specific practical instructions that are absolutely vital for preventing complications and just safely navigating daily life post-surgery. Simple things, right? How to properly care for the surgical incision to stop infection. How much weight is actually safe to lift to avoid hernias or re-injuries? When is it truly safe to start driving again or climb stairs or do light chores?
Details they can get missed.
They often do, but they significantly impact healing and can prevent serious setbacks. This clarity is essential for a safe, smooth recovery. It empowers the patient and caregivers to confidently manage things at home, preventing painful mistakes just because they didn't know.
And often, for older patients, just maintaining or regaining mobility is a huge concern. So, the 13th question is vital. How will I become active again, or at least be up and moving after surgery? This isn't just about hopping out of bed the next day, is it?
No, it's not just about getting out of bed, it's really about getting back to life. Immobility can lead to a whole host of serious problems, especially in older folks, dangerous blood clots, pneumonia from not breathing deeply, and significant muscle weakness, what we call deconditioning.
And deconditioning can be serious.
It can be very serious. It can turn a temporary surgical weakness into a profound, long-term loss of independence. So this question focuses on the actual plan for regaining mobility and independence. Will there be physical therapy in the hospital? Will you get a referral for outpatient therapy? Are there specific exercises to do at home? Understanding this proactive plan is crucial for preventing that downward spiral of weakness and ensuring the patient maintains or regains their overall health and ability to function. It's about building that bridge back to an active life.
Okay, that covers the immediate recovery phase. The next category is rehabilitation and ongoing care needs. This seems to bridge that critical gap between the hospital and home, which, as you said, can be a point of vulnerability.
Yes, it absolutely anticipates the needs that go beyond that acute phase of immediate post-surgical healing. The 14th question here is, do you anticipate needing home health or rehabilitation services?
And why is it important to ask this proactively, maybe well before discharge is even mentioned?
Because it proactively addresses the crucial need for support systems that might not be immediately obvious while you're still in the hospital bubble. Rehab services could mean physical therapy to get stronger, occupational therapy to relearn daily tasks like dressing or cooking safely, maybe even speech therapy if the surgery affected that. Knowing this need in advance allows families time to investigate options, understand insurance coverage, make necessary arrangements like securing a bed in a rehab facility, interviewing home health agencies, maybe setting up equipment at home. It avoids that last-minute scramble, which just adds huge stress to an already tough situation.
Makes the transition smoother.
Significantly smoother. It prevents gaps in care.
And if those services are needed, the 15th question becomes absolutely critical. If so, how will my transition of care be managed? Will I receive a plan?
Seamless transitions aren't just nice to have, they are absolutely critical to prevent dangerous gaps in care and ensure things continue smoothly. A clear, detailed plan for moving from hospital to home or to a rehab facility dramatically reduces anxiety for everyone.
What should be in that plan?
Ideally, it should detail exactly who to call for what kind of problem, a clear medication schedule, a list of upcoming appointments, and any specific instructions for ongoing care like diet restrictions or warning signs to watch for. A well-communicated, explicit plan improves outcomes by ensuring consistent, coordinated care and significantly cutting the chances of preventable readmissions just due to confusion or unmet needs.
Right. It's about empowering the family with a blueprint.
Exactly. Empowering them to be the patient's advocate, armed with clear information.
That makes so much sense. Connecting the dots, preventing people from feeling lost. Okay, finally, we move to long-term prognosis and follow-up. This is about life well beyond the immediate recovery, looking down the road.
Indeed. It's about building a sustainable path forward. The 16th question in this critical long-term phase is, how will my pain be managed after surgery?
Why focus on pain management long-term? Isn't that mostly right after surgery?
Well, yes, acute pain is expected right after, but effective pain management is central to both immediate comfort and, importantly, a successful long-term recovery. Uncontrolled pain isn't just unpleasant, it can be debilitating. It hinders mobility, messes with crucial sleep, and can even significantly contribute to post-operative confusion or delirium, especially in older patients. This question ensures a comprehensive plan is in place. Yes, to address the acute post-op pain, but also to anticipate and manage any potential chronic pain that might linger from the surgery or the underlying cancer itself. Knowing the strategy meds, physio, other non-drug approaches empowers the patient and caregivers to advocate for comfort throughout the entire healing journey.
And speaking of confusion, the 17th question addresses that very specific concern for older patients you mentioned. How to identify and prevent confusion after surgery.
This is a truly vital question, especially for older adults. Post-operative delirium, other cognitive changes, they're significant concerns affecting a pretty large chunk of older surgical patients.
And scary for everyone.
Incredibly distressing for the patient who might have hallucinations or feel profoundly lost, and equally alarming for families witnessing it. So, understanding the signs, sudden shifts in attention, confusion about time or place, altered consciousness, and knowing preventative measures.
Like what kind of measures?
Things like trying to maintain a regular sleep-wake cycle, ensuring good hydration, encouraging early movement, minimizing disruptive hospital noise. These empower caregivers to act quickly if they see changes. This proactive approach can really make a difference in reducing the severity or length of confusion, leading to a smoother, less traumatic recovery.
Okay, and then looking even further ahead, the 18th question is a big comprehensive one. What is the long-term prognosis? What is the follow-up schedule? And what are the signs of recurrence to watch for?
Yes, this multi-part question is essential. It helps create that long-term care plan and provides a crucial sense of control and preparedness.
Right.
Knowing the long-term outlook for your specific cancer type and stage, understanding the frequency and type of follow-up needed scans, blood tests, clinic visits, and being explicitly told the specific signs or symptoms of recurrence to watch out for this allows for early detection and intervention if the cancer unfortunately comes back. This detailed knowledge empowers patients and families to actively monitor their health, report concerns promptly, and really participate in their ongoing care strategy.
Reduces the fear of the unknown.
Exactly. It gives a clear, actionable path forward, provides a roadmap for living with the long-term reality of a cancer diagnosis.
It's a lot to keep track of, but it's about understanding the whole health picture, which brings us right to the 19th question. How will this surgery impact my other health conditions?
This looks at that broader landscape of the patient's overall health, which, as we've discussed, is so incredibly critical for older adults often juggling multiple conditions. Surgery, for one thing, like cancer, absolutely can and often does affect other conditions.
Well, like how?
Well, will a major abdominal surgery impact their long-standing diabetes management? Will they need new medication adjustments? Will the stress of the procedure worsen their heart condition or put extra strain on their kidneys? Understanding these potential interactions ensures a coordinated, safe approach to their complete well-being, not just treating the cancer in a silo.
So maybe involving other doctors.
It might mean adjusting medications, more frequent monitoring for certain conditions, or collaborating closely with other specialists like their cardiologist or endocrinologist. It's about truly holistic, integrated care, anticipating those ripple effects.
And finally, a question that, sadly, often gets overlooked in the middle of all the medical details, but is so fundamentally vital. The 20th question. What are the emotional and mental health supports available?
The emotional toll. It's immense. The anxiety before surgery, the realities of recovery, just the weight of a cancer diagnosis, it impacts both the patient and their family profoundly. It's a massive life upheaval. It can lead to anxiety, depression, that persistent fear of recurrence, changes in body image, self-perception. Addressing these mental health needs may be through professional counseling, joining support groups for patients or caregivers, finding other community resources. It's a key, often neglected part of holistic care.
Because healing isn't just physical.
Exactly. True healing is profoundly psychological and emotional too. Ensuring these crucial supports are identified and made accessible is paramount for overall well-being, for resilience, and for maintaining a meaningful quality of life throughout the entire cancer journey.
That is an incredibly thorough set of questions, really covering everything from the most basic understanding of the surgery itself, right through to long-term emotional well-being. It truly drives home the immense value of this proactive questioning approach.
Exactly. Our sources make it abundantly clear. This thoughtful, detailed, and ongoing conversation, meticulously guided by these very specific questions, is the absolute bedrock of making an informed decision for older patients and their families. It's often not about finding a perfect option, because, let's face it, in many of these complex, high-stakes situations, a perfect option simply doesn't exist. Instead, it's about making the best possible informed choice, given the specific circumstances, the patient's overall health, their physiological reserve, and, crucially, their deeply personal values. It's about aligning the medical intervention with individual human priorities.
And that's where the true empowerment really comes from, isn't it? By diligently asking these questions, by engaging proactively and courageously with the medical team, patients and families can navigate this complex, often frightening landscape of cancer treatment with a much clearer understanding.
Understanding the benefits, the risks, the real-world challenges.
Exactly. And this process transforms them from just being passive recipients of care into active, informed decision makers. It empowers them to make choices that are truly in line with the patient's deepest values and their personal priorities for a meaningful future, whatever that future might hold.
It brings a sense of agency back.
Yes, a profound sense of agency to a situation that can otherwise feel utterly overwhelming and out of control.
So, as you, our listener, reflect on this deep dive, maybe consider this thought, how might proactively addressing these questions not just once at the beginning, but really throughout the entire process, from diagnosis through surgery into recovery and follow-up, how might that fundamentally shift the whole experience of illness and healing for older adults and their loved ones?
Yeah, think about how that comprehensive, compassionate approach could foster not just physical healing, but also a deep sense of peace of mind, maybe a renewed sense of control, and a shared understanding that really strengthens that vital relationship between the patient, their caregivers, and the medical team. It's about moving from feeling overwhelmed and adrift to feeling truly informed, prepared, and more in control of a journey that, while undeniably challenging, can perhaps be navigated with greater clarity and purpose.